Hello and welcome to a brief introduction to the game Choices, the Opioid Crisis. I'm the designer Tom Grant, and this is our latest game that we've developed to help people learn about important public issues and to promote better dialogue among interested people on issues like the opioid crisis. I'll talk a little bit about the objectives of the game and then how to play it. So, this is a game, as the title implies, about choices. What do we want to do when we say we want to address the opioid crisis? Do we want fewer users? Do we want fewer people overdosing and dying? Do we want less crime that arises from opioid traffic? Do we want something else? So the game is intended to give you the opportunity to figure out what choices you want to pursue. And the you in this case is you playing the role of an interest group. Now, there are several interest groups in the game. These are just a few examples. And every interest group has some outcomes that it's interested in bringing about. Not every group wants the same thing. And so, therefore, a big part of the game is trying to find out who are your allies and building a coalition to pursue a particular solution that you find promising. The tricky part is that, as is the case in the real world, in the game, the policies that you choose to address the opioid crisis don't have definite outcomes. There can be unexpected consequences. You enact a policy and then you see what happens, and you hope that what you expect to happen will happen, but maybe it doesn't. And then the game asks you what adjustments are you willing to make in order to accommodate these unexpected outcomes. Playing the game is fairly simple. You just need to understand three concepts. First, the groups, the different interest groups, and the policies that are designed to bring about particular outcomes, and the outcomes themselves. And if you have those three pieces down, then you are definitely able to play this game. So every group, as I mentioned, has a set of outcomes that it's seeking. It also has a certain number of votes that it can use whenever a policy comes up for a vote. And you can vote to enact policies and also to repeal policies that have been enacted. Now, the policies, for the most part, are going to bring certain facts about the opioid crisis down. So it might be that a particular policy will lower the number of user deaths or lower the cost of healthcare. In some cases, unintended consequences will raise some of these parameters of the game. So you might lower user deaths but increase addiction-related crime. Most groups in the game, most of the interest groups, are interested in lowering these different outcomes. There are a couple of outcomes that two of the groups are interested in raising, and that is kind of pharmaceutical profits and insurer profits, and not surprisingly, pharmaceutical companies and insurance companies, they're ones interested in that. So, what you do is you figure out what policy you want to try to enact. You take a look at the possible or likely consequences, and once it's passed, you find out what the real effects are. So you have two turns in which you're going to be voting, enacting the policy, and then discovering what the real outcome is. Now, as you might imagine, in the course of those two turns, there's going to be a lot of negotiation. So groups are going to make offers and threats and statements and whatever else they need to do in order to pursue the policies that they want to put into effect, they want to enact, or they want to take off the table, they want to repeal. So you do one turn, you see what happens after everybody has a chance to propose policies that they want to that they want to enact or repeal or pass. You do it a second round, and then you tally up the score. And the score is really a question of how much you got of the outcomes you were seeking. So if your goals were to lower user deaths and to lower healthcare costs, then you see, did that actually happen and by how much? And if you got more of what you wanted than everybody else, then you were declared the winner of that session of Choices, the Opioid Crisis. Now, playing a game like that, it's nice to have a winner. It's not the reason for playing the game, though. As I said at the very beginning, the reason for playing the game is to have a conversation afterwards. And so, really, it's designed to play fairly quickly, and then give some time to ask questions like, why did the game turn out the way that it did? What did we learn about the opioid crisis? Uh, did you change your mind about any of the policies that you thought might look promising or might look threatening or useless to you before playing the game? What did we learn, and what are we going to do with that knowledge? That's really the kind of the whole point of the game. I should say the game is also free when it's going to be available. You can download it and print out the materials and play it yourself. We're doing the game really as a public service just to improve the political dialogue here in this country. Uh, by now, you've heard all the basics of the game and you're ready to play. The game's not available as of the time that I'm recording this tutorial video, but it will be soon. It's in the process of play testing, which means we're testing out the game with groups and tweaking it and so forth. If you want to follow the progress of the game, here are the websites to go to do that, and also to learn about other quote-unquote serious games that we've developed or other people have developed to address important needs like education, bridging political divides, getting insights into what customers and voters want, all the different interesting things people have done with games. That's a big part of our mission in life, is to spread that knowledge around. So if you're interested in the world of serious games, you'll find out more information about that. You'll also find out more about the opioid crisis. We're putting together a list of references for people to read following up after playing the game. And that's it. So we hope that you enjoy playing Choices, the Opioid Crisis, once it's available. And if you have suggestions or questions, just contact me at the email address below. Thanks for listening.